For people that could not make it to today's webinar, we will make sure that we post our PowerPoints and any resources we've talked about during this webinar, and also a recording, so it can be viewed at a later time. Again, I just wanted to put a couple of pictures of the presenters so you can put our faces with our voices. I am the Associate Director of the HealthMatters program, and we are also stationed at the Rehabilitation Research and Training Center on Developmental Disabilities and Health at the University of Illinois in Chicago. I recognize many of your names on this webinar, and some of your new names, so hopefully you can learn a little bit about us just by visiting our website. I will let my colleague, Kristin Krok, introduce herself really briefly, and we will begin. Kristin?
Hi, everyone. This is Kristin Krok. I work at Northpoint Resources, which is in Zion, Illinois, very close to the Illinois-Wisconsin border. And Northpoint is a community-based organization. We work very closely with the HealthMatters team, with Jasmina Sisirak and her colleague, Beth Marks. I'm really excited that we're having these webinar series, and really pleased to talk to you later in the webinar.
Thanks, Kristin. Just a little bit of a housekeeping. If you have any questions, please put them in question and answer or a chat box. Preferably towards the end of the presentation. We will be presenting about 40 minutes, and then we will leave some time for you to ask questions. And we also want you to share some ideas if you have, if your organization has implemented healthier vending options, or any other suggestions that you may have. Today, we're not promising that we will be resolving our healthy vending dilemma, but really wanted to make you aware of resources that have been developed and some research that's showing some sort of promising approaches. And also, please share your stories. So today, goals for today, we want to give you some steps to develop healthy vending machine initiative, provide you with some tools to survey vending machines and implement new guidelines, and and involve your staff and people that you support in these decision-making pieces, and then provide you with some research news. Kristin will talk about a real-life case study from her organization, how they have turned around their vending services, and then again, encouraging you to share your stories. A little bit of a background, why focus on healthy vending? Adults on average spend a third of their day at work, snacking, eating meals, consuming beverages, and vending is oftentimes a part of your nutrition. And vending usually contains mainly, for the most part, processed food options that are usually high in fat, salt, and sugar, which is very tasty to us. And then the fresh food is rarely available. So these environmental factors, location, convenience, and the taste of these foods are creating a perfect storm of poor nutritional intake, which is really putting us at risk, and looking at dietary risks are #1 cause of preventable mortality. So we really want to be thinking about these pieces. I really wanted to focus on sugar-sweetened beverages for a couple of slides. They're no longer considered a treat, but a regular contributor of daily calories, and not even in moderation. They play a significant role in current obesity trends, and 10% of daily calories consumed by Americans in an average U.S. diet is coming from sugar-sweetened beverages. 63% of adults and 80% of youth consume at least one sugar-sweetened beverage each day, which on average ends up being about 46 gallons per year per person. And this is only looking at sodas or soft drinks, not necessarily thinking about other sugar-sweetened beverages that you may be consuming. So what is a sugary drink? Sodas and soft drinks, fruit drinks or punches, and aids. Sports drinks are considered sugary drinks. Energy drinks, flavored milks, and teas and coffee drinks with caloric sweetener. And this is the last slide about sugary drinks. They really are a leading contributor to obesity in both children and adults. The link is especially strong in children, where each daily serving of sugar-sweetened beverage is associated with at least 60% increased risk of obesity. Added sugar contains no essential nutrients, and it's bad for your teeth. There are no proteins, essential fats, vitamins, or minerals in sugar. It's just pure energy. And when people eat up to 10 to 20% of their calories as sugar, this becomes a major problem and contributes to nutrient deficiencies. Added sugar is high in fructose, which can overload your liver and causing non-alcoholic fatty liver disease. And evidence is really arising that it's showing that the fat, that it's the sugar that raises your cholesterol and gives you heart disease, not the fat. So it's really something to think about. Sugar can cause insulin resistance, which is a stepping stone towards metabolic syndrome and diabetes. And insulin resistance can progress to type 2 diabetes. So it is, if anything, really focusing on those sugary drinks could be your stepping stone to healthier vending. Obesity epidemic, the sugar and vending really is contributing to the rising obesity epidemic in the United States. 72 million adults are overweight or obese. 27% of the rise in healthcare costs are associated with increases in obesity rates. Looking at adults with intellectual disabilities, their obesity rates are, the studies show higher or equal to general population. And having a healthy employee is really having a more productive workforce. Healthier employees miss less work, they have fewer healthcare costs, experience fewer injuries and accidents, and have better morale. So organizations can make a difference in the health of your employees and people that you support. So providing opportunities for healthy eating is really crucial in the prevention and management of overweight and obesity. Employees can implement policy systems and environmental initiatives that make healthy food more affordable, accessible, and appealing. So that was a little bit about background of why we've decided to do this vending machine presentation. We have worked with hundreds of different organizations throughout our over 15 years of working in HealthMatters. And one of the consistent sort of troubles and issues that people talk about are vending and trying to figure out how you can come up with some healthier vending solutions. We also had a survey and surveyed over 240 different community-based organizations providing services to people with developmental disabilities. And we asked them about their vending. And this slide really shows some of those, some of that information. About half of the surveyed organizations had vending services. About only 30% of them had fruits, low-fat snacks, or other healthy food alternatives in their vending machines. About 64% of them had healthy beverage alternatives. 14% only had labels that identified healthy foods on or near vending machines, and only about a quarter of them had labels indicating nutritional value provided on or near vending machines. So there is definitely room for improvement. And then the top of this graph is the wellness committee. We also asked organizations, how many of you have a wellness committee? And out of 241, only 18% had a only 41 had a wellness committee. So just thinking about your organizational wellness, starting somewhere would be to create a wellness committee or even call it a vending committee to start thinking through some of these issues. So what do we do with this? We want to make change. This slide really is going to, I'm just going to run it down, and then I will delve into each one of these bullet points. So we really want to get the organizational commitment for healthier vending, build that leadership team either through a wellness committee or a vending committee, or you can just build a team. You don't have to call it a committee. Gather information to understand what's going on with your vending services, develop implementation plans, implement the change, and then evaluate. Before I talk about kind of getting organized, we do get a lot of people saying there are some challenges. There's resistance to change, and staff and people with disabilities saying this is my right to choose what I want to eat from there. But that is something that we want to work on by bringing people to the table and communicating and collaborating together to come up with a vending that is agreeable and for the most people. And a lot of times we get people saying if we change vending to a healthier vending solutions, the cost of those items may go up, or the vendor may be complaining that they won't be making enough money on those machines. A little bit about what research shows in regards to that. I added, there have been dozens of studies in the last 20 years done on the vending in organization, and I just put a couple of them that were kind of the most interesting ones. Also, there was a study done on reviewing all the research that has been done, and they have really found out that price reductions were most effective overall towards help to actually make a change to a healthier vending, meaning if you reduce the price of those healthier food items, you're bound to have a more acceptance for a healthier vending. However, the revenues from vending sales did not necessarily change substantially regardless of intervention, of what people were doing to make them vending healthier. So that's very promising and exciting. So when you go back to your vendor, you can really tell them about the research and say that the revenues usually don't change. So looking at a couple of these studies, the most recent one is this Rush University Medical Center study. It was just, it was featured on NPR about a week ago. And what they used was a device that fits inside of a vending machine and waits for 25 seconds before releasing the typical processed snack versus that healthier fare like a peanuts or popcorn, they drop instantly. So it was interesting that they found that people that were forced, and there was a sign posted that for your less healthy option, you will have to wait 25 extra seconds. So people were opting out to choose healthier snacks because they did not want to wait those 25 extra seconds. They also added a 25-cent tax on unhealthy snacks, and then they showed that the combination of increasing the price of unhealthy snack and also waiting for that unhealthy snack resulted in a greater increase in healthier food option from that vending. So that was pretty exciting. This is the newest research. It was just published a week ago, so but it's something to think about. The Minnesota Bus Garage study and the CHIP study also used, they reduced the prices of different healthier or low-fat snacks, and that also showed that it improved the consumption of healthier food, healthier snack alternatives. So it's a promising way of making people eat a little bit healthier. So going back to how to begin to thinking through towards a healthier vending machine initiative, one of the pieces you should do is to administer a vending machine inventory. And this inventory, and I'll show you the one, we really utilized some really great resources, and we will share and post them on the site so you don't have to be taking any of these notes. King County Healthy Vending Implementation Toolkit had a really nice comprehensive resource list and toolkits and things that they've developed. With this inventory, looking at what you want to really look at is frequency, preference, interest in healthier options, and price points. So let me just show you one of the sort of samples, and it's a quick survey, and you can administer it to your staff and people with disabilities, and to understand how often people utilize the vending machines, what types of snacks they buy the most, if there were healthier alternatives, which ones they would probably buy, and how much are they willing to pay for. So it's a really nice way of gathering information and being able to talk to your vending supplier to kind of think through some of those changes. Once you've done the inventory, reporting the inventory results to the management, and then really thinking about requesting some improvements in being specific with those. And also another step is to meet with the person that's responsible for vending services and contracts. This is very important. Without their buy-in, you would obviously go nowhere. So just bringing that person to the table. And then once you meet with them, introducing the idea of healthy vending and requesting a list of available healthy items or healthy programs from your vending company. Oftentimes the vendor will have some healthy program initiatives as well, so it's an important one to ask. The next step is to develop an implementation plan. So what does a healthy vending machine look like? There are a lot of resources showing those things, and I'm just going to skip. So, there's a lot of sample nutritional guidelines that you can find. We've just given you some of these that come from Alliance for a Healthier Generation and the American Heart Association. So it really depends what your vending inventory says, where you can kind of start thinking about some of these nutritional guidelines and implementing. Also, the King County Healthy Vending Implementation Toolkit has a really nice table where you can actually go down the list of fruits and veggies and grains, nuts and seeds and dairy, beverages, and understanding what's the healthiest choice, healthier and limited. So if you can't get all items to be healthiest and healthiest, you can look at some of these limited options too. So that's, there's your resource for thinking about how it looks like in the vending. Voicing your choice, it is also, as I've said before, important to educate your employees and people with intellectual disabilities about making those healthier choices from vending machines. And how you do that is really bringing them to the table and introducing them to some of these new choices that you want to possibly implement in your vending. So there's a really nice resource. Indiana University did a taste and tell vending initiative where they asked their consumers to rate the different healthy snacks that they were planning on implementing. And from there, they made decisions on which vending machines should have with different types of snacks. So doing a taste test and Kristin will talk about that in her organization. They've done things like that to really bring people to participate in this decision making. And then lastly, and most importantly, is to adopt a healthy vending policy. Without that policy, a written policy, you don't really have anything to support your initiative. There are a lot of different sample vending policies available online. This is just one of them. They're just nice tool where you can kind of think about how you, why you're doing a healthy vending initiative or policy, and what the nutrition standards are and the beverage standards, and then pricing and placement standards. So you can utilize some of these vending policies to really implement them and adopt them. So the next step is to implement the change. You will be negotiating with the vendor to increase the number of healthier choices available. So depending how you are set up with the vendor, there is a sample letter to vendor that you can use, or if you're meeting with the vendor, you can be doing some of these things face to face. Also, another great idea is to start placing signs and sample health messages on or around the vending machines promoting healthier choices. And these resources that are around, they have a bunch of them with the King County Healthy Vending Implementation Toolkit. The one that you see on your on this slide, I made in 10 minutes. It was a really quick one, but it's a really nice way of alerting staff and people with disabilities about thinking about your health messaging and making them aware of the changes. And then sometimes organizations are not necessarily completely ready to tackle the vending machines, but you can do some other small steps. So even thinking about Rethink Your Drink campaign, thinking about changing what the choices people are making even before they get to that vending machine. We have used Rethink Your Drink campaign during our webinar trainings, and a lot of organizations have adopted it, where you sign up, you take a pledge that you will drink less sugary drinks, and you can even buddy up and have sort of a peer support model where a staff member and person with disability have pledged to decrease their soda intake or something like that. And then thinking about health-friendlier model. So if there is, organizations can choose to implement the guidelines at your appropriate level, which is whatever is acceptable to your consumers and people and your staff. And you can also change the mix of the products in your vending over time. So obviously the recommendation is, for the long term, is to offer only healthiest and healthier items, food and beverages. However, you may decide to do a harm reduction model, which best fits, and you can start with, 30% or 50% of the items are going to be healthier options or healthiest options items, with the goal to really reach that 100%. And then also thinking about even healthier food options being placed in best spots in the vending machines, or even thinking about repricing and either increasing the prices of less healthy options versus healthier options. And then at the end, we really recommend for you to conduct evaluation, to document these processes and outcomes, and really to understand what's happening, looking at the changes. Is it working? How can you adjust it? Then monitoring and maintaining these changes, making sure that the vending machines are properly labeled, priced, there's correct location of those healthier items, and you're posting signs and doing health messaging. And then the best way to see if it's working is to really evaluate vending usage and sales before and after you do this initiative. I'm going to stop here, and I'm going to let Kristin talk a little bit about what they've done at Northpoint Resources in their real-life case study. Kristin?
Hello again, everyone. Jasmina, are you giving me control of the slides? Or let me know. So I did want to share some information with you about my agency, Northpoint, and there's not really any right or wrong way to go about doing this. I'm so excited that you're all here to learn more about it and make some small changes perhaps in your organization. I do want to share our story, as Jasmina said. And so in about 2011, Northpoint, the contract that we had with our existing vending machine company at that point was coming to an end. And at that point, we had probably about 2 or 3 soda machines, at least 2 vending machines that had snack-type items in them, chips, all that kind of stuff. And then we also had an ice cream machine. And even really before 2011, Northpoint had been thinking about making some type of change to provide healthier options. And kind of where we got hung up was someone missed the opportunity to end the contract, and it rolled over. And so we kind of had to, deal with the vending company contract for at least a good another year. And so when we were then made more aware of when our contract was ending, we really began to take a look collectively, Northpoint, to make some decisions about what we wanted to offer that would include those healthier options. And so the Wellness Committee, really with the support from our leadership, identified the need for a change. We really didn't know what that change was, what it looked like, how it would be implemented, but we really knew that we wanted to offer healthier options for everyone here at Northpoint. And that support was also coming from the data that Northpoint had from our participation in an HMA, which is a HealthMatters assessment. Staff at our agency took this assessment through HealthMatters team, and that information from the assessment kind of really led us in the direction of that we wanted to make that change. There was some information that came from that assessment that supported the fact that people were looking for healthier options when it came to vending, healthier options for snack. So just as Jasmina mentioned, we really did take the time, and it was a process, a definite process. We met with several different vending companies, including the one that we were currently in contract with, and we had meetings here at our agency and invited the representative from that company to come. We had numerous people from different departments around Northpoint come to those meetings, and members of our Wellness Committee, and really proposed the idea and discussed with those representatives from the company the idea of healthy vending, what we thought that meant to us, why it was important, what it might look like. And some were more receptive than others for exactly the same reasons Jasmina spoke to earlier. They felt perhaps that they weren't going to have as much income coming from those items. Those items would cost more, and people would choose not to purchase them. So through the course of conversations with the vending companies, we were able, and they usually came with, we requested that they bring a list of the different available healthy items, and those lists were pretty extensive at times. They would list all the nutritional value or lack of there within that report. And we also discussed ways with those representatives on how we could identify the healthier choices, some of those things that Jasmina showed you, whether it was a heart healthy sticker or some way to health message either inside the machine or outside the machine, how individuals, how staff, whomever would be able to identify those healthier options in the machines. And some companies were even really willing to supply us with different products we were interested in that were healthier options, so that we could use that for taste testing with everyone here at Northpoint. So that's kind of how we went about gathering information to make a plan. So we really then, after those meetings, decided that, yes, we did want to move forward. We wanted to have healthy vending at Northpoint, and kind of how we were going to go about to do that was we really, from the get-go, even when we were meeting with companies, we really involved everyone. Consumers were involved, our staff were involved. It was a continuous dialogue, whether it was at staff meetings or we have consumer council meetings where those individuals that we support are at those meetings. We really felt it important that everyone have the information, everyone was educated, they had the knowledge, and could help make those, help make a plan for what the future held for us. We did have multiple taste testings in the different phases of our project and our plan, and we really wanted to explore with individuals, the textures, how things looked in the package, how the packaging looked, the flavors, the taste of items. And I don't quite recall how we recorded all that information, but we definitely had a way to gather the data on people's preferences for different items. We really made sure that families were aware of what we were looking at, that the different community partners we had for individuals who come to Northpoint for a program, that they were made aware of those changes too. We really wanted to educate everyone about making those healthier choices. So as we went through that process, the recommendation really was from the Wellness Committee that we wanted those vending machines to leave the building. We had met with a company that had all healthier choices and snacks. And even after meeting with them, we felt that we wanted to create a cafe of some sort within our break room where individuals have lunch. And that's kind of how we moved forward from there. We wanted those machines to leave the building. So that change was implemented. And the Wellness Committee and everyone who was involved developed the Northpoint Wellness Cafe. And along with that, we had recommendations and criteria for products to sell. We really started off with trying to find things that, and maybe not all these things have kind of remained in this category now, but we wanted to find maybe organic when possible. We wanted to find items that had no high fructose corn syrup. We wanted items that had no trans fat, no preservatives. We have individuals, who are on gluten-free diets. We have individuals who are on dairy-free diets or allergies. So we really wanted to take a look at some of those types of products as well. And so we did some homework. We looked at some of the things that the companies were providing that fit those categories. And we really also didn't start off way too big. We picked a handful of items, I would say 5 to 10 items at first that we were going to put in our cafe. We really wanted to offer those healthy choices because the vending machines were starting to become people's lunches. People weren't bringing lunches and were purchasing items out of the machines that then became their lunch. We also established a business plan, what we wanted everything to look like, the logistics of the cafe, who was going to run it, how to supply it, the hours, the products. We decided that the hours of the cafe would mirror our lunch times. We have 2 different lunch times. So the cafe, and to this day, is currently open from 11 to 12:30, and then it's open at the end of the day from 2 to 3 when everyone is getting ready to leave for their day and walking out the door in our bus checkout area. Initially, our wellness committee were the members with individuals who were manning, if you will, the cafe. We had a rotation in a schedule, and different members of the wellness committee were there running the cafe. As time went on, another department took that role over, and it's kind of ebbed and flowed throughout the years, and I think eventually it will change again as well. But it was a good opportunity to get individuals that we support involved to learn and to work on money management skills, how to track what's sold, how to take inventory of stock, or how to stock the supply that we have, and appropriate and good social interaction skills with people who are purchasing items as well. So the grand opening of our Wellness Cafe happened in the beginning of 2002. The vending machines left the building. I'm sorry, 2012. I misspoke. The grand opening was 2012. The vending machines left, I think, on a Friday, like around our holiday break, and when everyone came back from the holiday, we were all set up, ready to go. We took a lot of time to kind of brand our cafe, have, you know, a logo, have signage that was accessible to everybody around the cafe. We created a visual menu of different products, so that we took pictures of items that we were going to sell, and we put the price underneath, and we have those displayed on the top of the cafe cabinet that we use, so that people can look at the items, take the time, and perhaps if they want to point to items. Or for example, you'll see a picture of LaCroix on your screen. We might not always sell LaCroix, but we usually have seltzer water and bottled water, and we buy different flavors. So if we had an image of a can of sparkling seltzer water, we were able then beneath to put the different flavors that we have, so people were aware of those and can choose items accordingly. So at our cafe, we have bottled water. We do sell the sparkling fizzy water. We have items like pop chips, veggie sticks, veggie straws, pretzels, pirate booty, granola bars, kind of all different variations of those things I've mentioned, and really to offer healthier options, healthier snacks. We also have, I mentioned before, we had ice cream machines, and so we have a fridge and a freezer that stock our cold items, and so we have these items I think they're called Tofuti Cuties. So they're dairy-free, gluten-free, soy-free. It's a nice little snack, kind of ice cream alternative and treat for people who are looking for that as well, and they come in different flavors. We were really lucky in the sense that when we were trying to develop whatever we were going to move forward with, in our break room, we had a space that at one time held a cabinet. Way back when, that cabinet had snacks and, you know, candy, and I think even at one point way back when it held cigarettes, I hate to say, but there was lots of things that people could choose to buy throughout their day. This is before we maybe had our vending machines. The vending machines came in and that little cafe kind of left. So we still had that cabinet in our warehouse, and so we utilized something we already had and put it in place in our break room. But there's all different kinds of ways. It could even just simply be a cart or a cabinet that is utilized and open. But we were lucky in the sense that we already had something that we could utilize. We did take small steps, and we continue to take small steps. They're really important. As we were developing the cafe, we did health messaging. So we let people know what was going on. We, again, branded the cafe and had the logo and all the information people would need to know around the cafe and throughout the building regarding the hours. It was really important that we did that throughout our building. Maybe an email blast. We sent health messaging to families, to our partners, so everyone was aware of the changes that were taking place and how we were going about doing things. We did really have a Rethink Your Drink campaign. We didn't call it that at that time, but for those soda machines to leave our building and for us to then be selling water and flavored water, that was a big change. And we completely rethought our drink. And I think we continue to do that. We're actually at the beginning of a six-week challenge here for everyone who's interested at Northpoint, and we're using those resources that Jasmina showed you to have a Rethink Your Drink campaign, to have people pledge to decrease the amount of sugary drinks that they ingest. We also, at that time, too, we had a coffee machine, a coffee pot in our one of our break rooms, and at that point, Northpoint was paying for the supplies for that coffee machine. When our cafe came, we really changed it around and said, okay, if you're interested in, or you're wanting that coffee, there's kind of like almost like a monthly due that you're going to have to pay that would then provide for those supplies. And eventually that even faded out, and there's not even a coffee machine in the general areas of Northpoint. When our cafe was put together, we also had a different department, pardon me, who developed a wellness cart. And every morning at a certain time, they would bring the wellness cart around, have fresh fruit on it. They made homemade granola. They took orders, and they would bring you the items that you had ordered. And that provided another opportunity. It was mobile. It worked on different skills that people were wanting to learn more about and to address within their service plans. We don't have that cart anymore, but that's something else that we did that was a small step. And we've always had something like a wellness weekly, which I kind of equate to health messaging too. We really do email blast out and put information in strategic places around our building that is sharing just basic health information with everybody to continue moving forward in making those healthier choices. There were definitely opportunities and challenges, and I intentionally put opportunities first because I think this really was an opportunity and that things presented itself at the right time for us. The timing of this change kind of fell into place. With our contract ending, with the wellness committee supporting it, all those things really worked nicely together. And I think it was essential that we really did make sure that everyone had the information. Everyone was extremely pleased about the information at different times, but it wasn't something that came from up top and it was done. It was really, we wanted everyone to be involved in the process, and I think that was really beneficial to the whole development of it. As I mentioned, the location of the cafe, we kind of had all the pieces in place, and we just put them back to where they once were for the space of this cafe and cabinet where we have our little cafe. The wellness committee or some type of group like that where there's interested parties together to help make some recommendations that you can approach your leadership team with is really essential, and it really should include different areas of your agency and organization and utilize that as a support network and for making those recommendations to leadership, as I mentioned. And I really think that it opened up dialogue for everyone. It opened up the opportunity to educate people, because one of my challenges that you see there is the resistance to change. And the resistance to change honestly really wasn't from those that we support. It was so much more from staff who would approach members of the wellness committee and say, you're taking away their rights to use those machines. Well, no, we weren't viewing it that way. We really were offering, we felt that as an agency, Northpoint really had the obligation to offer healthier choices. So we weren't taking away choice. We were offering healthier options and healthier choices. And so there really were honestly some ridiculous stories and things that our staff would say and look to the committee to problem solve, and we kind of really held steadfast. This is something that we're offering healthier choices and help that be our mission. There was, I think, some challenge, and maybe it wasn't challenge, maybe it really was an opportunity now that I think about it, but there was a cost differential, and we did our very best to make sure that that cost differential was not a huge amount. But when you have individuals, and staff included, who go to the pop machine every day and it was 50 cents or 60 cents, something like that, it was very minimal cost, but who would put in 2 quarters and a dime every single day for how many years, that was so ingrained in people's routines. So it really was an opportunity to educate and to have people learn about different combinations of coins and different coins. And I think that actually was an opportunity, even though I have it as a challenge. So maybe it's a little bit of both. So that is my story about Northpoint, and I will turn it back to Jasmina.
Thank you, Kristin. We really wanted to keep this short and sweet, so we will take any questions you have or any stories that you would like to share with us in your vending journey. So any questions, you can type them in the question and answer, or if you want to raise your hand, I can unmute you so we can hear you. While we're waiting for any questions, just to confirm, we will be giving you a PowerPoint, and it was captioned, so we will be uploading it on YouTube or some other way, so you'll be able to view it, and then we will also provide you with a PowerPoint presentation, so you have all the resources in there. Any questions? Anyone wants to add anything? Well, if there are none, we will stick around a little bit more. For those of you, you can feel free to get off the webinar whenever you want. Kristin and I will just hang out a little bit more to see if there's any. Okay, so we recently changed vendors and have started replacing items a little at a time. Tanya, did you want to say this? Let me find you. Can you, oh, here, I'm going to unmute you. Do you mind speaking?
I don't mind at all.
Tanya? Okay, thanks.
Yeah. Can you hear me?
We can hear you.
Okay. Yeah, we just recently our vendor went. It was just a local couple, and they retired, and they sold out to Pepsi. And we kind of live in a rural area, and so that's really our only option as a vendor in this area. So I saw that as an opportunity to make a change, and we removed right now 3 of the soda options and put in. I know this isn't extremely a lot better, but Gatorade, 2 different flavors of Gatorade and bottled water in there. And I've had one complaint because Mountain Dew is gone, but then lots of people who were excited to have an option besides just soda. And so we do offer several diet options because we have a lot of health issues around here that most people do need the diet sodas, especially because of the diabetes and things. And then with the snack vending machine, the same thing. We're trying to slowly, remove some of the higher fat, higher sugar content items with the lower, more healthier type items, some gluten-free options, because we do have a few people that are on gluten-free diets. So although we didn't go through, just a regimented program, kind of like what you guys are talking about, we have started flowing in that direction, and we have 1 soda machine, 1 snack machine. So we're not real large, but so far I've not met with a lot of resistance. I think if we go a lot farther, there will be, and I think we'll experience that challenge. But you guys did give us a lot of good information to go with here. And we have a new wellness committee, but right now the wellness committee has only addressed staff needs. So that's a takeaway for me from this webinar, that I will be suggesting to our executive director that he ask the wellness committee to start addressing consumer needs as well for these kinds of things.
Yeah, Tanya, also if you, we have some wellness committee resources too, so if anyone is interested, we can share those with you. So, but just email me for those,
okay.
The info, so if you have, but like I said, we've given you sort of the fully loaded Mercedes version, or whatever you want to call it, but obviously most people or most organizations will start small, and that's where we talked about those small steps. And I think, with adding some of those health messages or health messaging and starting to talk a little bit more about why choose water or unsweetened tea or something like that versus a sugar-loaded soda, and how does that make you feel afterwards? Drinking that soda makes you feel sleepy at some point. So I think it's, I think starting with those health messages and slowly adding a couple more items, you may not. I think just bringing people to the table and for them to take charge of their health, and that's what we talk about all the time. It really does make them want to make these changes.
Mm-hmm.
So,
well, just the education.
Exactly, right. Kristin,
did
you have anything to add?
Yeah, I have a couple of thoughts. I'm really excited for you. So great, awesome job. I think that with your newly established wellness committee, you said you're focusing more on staff. Really think if the committee, if you can have individuals that you support, who would be a good fit, who would want to be a part of your committee, whether it's now or in the future. That's a really great way to have them involved as self-advocates as well.
That's a great idea.
And with your machines where there's water and the Gatorade and you have healthier options, think about some kind of Rethink Your Drink campaign. That take a lot of time or energy, but the resources that Jasmina shared, there are a couple different ideas for pledges. Put that, copy and paste it, put it on a piece of paper, and maybe when, during a period of a week or something, or a couple of days, when people are purchasing items out of there that are healthier, could there be a little stand or a little table where you have those pledges and they can put their name, and those can go up maybe around that machine or on some kind of bulletin board. So there's something visible that people can say, hey, I'm taking this pledge. Did you do it? And there might be some self-advocacy opportunities there for people to get their friends and other people interested in learning more about it.
Okay.
Just a couple.
Yeah, that's good. They all love recognition.
Yeah,
they all love recognition. Yeah. And the other thing that I heard you guys
demonstrating a visual that I'm part of something.
Yes.
And I'm making a healthier choice. That's encouraging.
I really liked the staff and consumer partnership. Like for just the accountability partner, because I see probably as many staff buying sodas out of that machine as I do as consumers, because we're all in a hurry. And I don't because I don't use any machines much at all, but that we're busy. You don't always think to pack something up and bring it with you, and so yeah, I do see a lot of staff using it as well. So I think this is a good time for me to learn this stuff. I'm not on the wellness committee, but I can definitely pass all this information along to them and have them add that to their plans. So a lot of good information today. I like the Rethink Your Drink campaign. That's neat, and as well as the accountability partner part of it. That was neat.
Great.
We had another person, Joni. Let me know if I'm going to unmute you and see if you're interested in speaking. By the way, thank you, Tanya.
Sure, thank you.
In Joni's organization, they installed vending machines with a bunch of healthy items, and then they get wellness points for choosing water over soda. Joni, do you want to just say a little bit about that?
Sure. We have a wellness program. I work for a health plan, and I work with the team in the health plan that supports all of the members that experience intellectual and developmental disabilities. But our company, which, provides just health plans, health insurance, they just recently installed this whole big area in our break room of different vending machines, and they have vegetable kind of things, and they have hummus, and they have just all sorts of water, drinks, spring water, living water, whatever, those kind of things. And then they have certain colored dots on the healthier choices. And we have a wellness plan that encourages people to do healthy things. And so if you purchase those items that have those colored dots that are healthier items, then you get points that go toward your ultimate goal.
But how is that going? Have you started it?
They just installed it about 2 weeks ago. So I don't know. I don't know how well it's going on, but I think it's a really great idea.
Yeah, so please keep us posted because this sounds like a really nice approach as well.
I will.
Thank you. Anyone else? Any questions or sharing ideas? Oh, Tanya asked, how do you monitor if someone buys an item with a dot? Joni?
That's a really good question. I'm not certain, except that everything is scanned. It's very electronic, and you can actually get like an account, and they issue you almost like a debit card. And so everything is scanned, just like if you're at the grocery store doing a self-checkout. So I'm guessing that the barcode corresponds with the healthier item and that's tracked. I can find out though.
Okay, great. Maybe the company too.
Yeah, well,
okay.
there's all kinds of products. So, you know, it's not like just a Pepsi or just a Coke or something like that. So I don't know how they get all of it supplied, but I can find that out as well.
Great, thank you. And if you don't mind just sending me an email and then I can share it with everyone. Thank you.
Sure.
Any other questions? Well, thank you all for sticking with us for this last hour. Again, I will send the PowerPoints and the recording. And please, there's a little short survey at the end that's going to pop up, and we ask you about different topics that you would like to hear. We do want to develop different topical areas that are of most interest to service providers, and we want to continue sharing disseminating some of this information via webinars. So please give us some of your ideas. Thank you, and we will be announcing shortly our next webinar presentation. Have a great rest of the day. Thank you.